Thank you for joining us for a brief update on the status of COVID-19 response in Boulder County and the resources and supports available to residents. Jeff Seok will provide an overview, followed by Frank Alexander, and then we will answer a few questions submitted from the audience earlier today. Jeff, take it away.
Thank you so much, Chana, and thanks everybody for being on this call tonight. I'm going to let you know that my name is Jeff Seok. I'm the Executive Director of Boulder County Public Health. I also have on the phone here with me and on Facebook Live, Frank Alexander, who is the Director of the Department of Housing and Human Services, Kate Haywood, who is our Deputy County Attorney, Chris Urbina, who is my Chief Medical Officer. So we're all here with you tonight. We very much appreciate that you've made time to tune into this. The first thing that I want to say is I've heard a lot of feedback over these last 48 hours, and I want you all to know that these are awful, terrible decisions, and we certainly know that. I can tell you that we have 531 cases as of today, and we have 34 deaths in Boulder County, and it's very unfortunate, and I feel for every single person that has had to go through that. It's terrible, and we know that this is a no-win situation. We also know that people and businesses are going broke. We know there's massive impacts on workforce and unemployment, and we know that there's serious behavioral health issues and suicide impacts, unfortunately. So it's a no-win situation, and I don't like this virus any more than anybody on this call does. It's an awful, awful thing that will leave scars on all of us for the rest of our lives. And I know that all of you are listening in tonight because you want to know why we extended this order. So I'm going to jump pretty quickly into that. We reviewed, and when I say we, I'm talking about Boulder County Public Health, along with the Metro Denver Department of Health directors, which is 7 counties around us, as well as our Colorado Association of Local Public Health Officials, which is public health directors from across the state, along with researchers, and our Colorado Department of Public Health and Environment, met weekly and looked at what are the data that we really need to think about before we consider lifting the orders to move forward. And we looked at national coronavirus plans. We looked at the White House plan. All the plans that we looked at all had several key components that were critical for us that we used in Boulder County. So I want to walk through those. The first one is that we really shouldn't lift any orders until we are not seeing increasing cases in our community, as well as hospitalizations. So I'm going to talk in a second about what that looks like for us specifically. We also know that testing, and if you've been watching any of the national news, you know that testing is huge. And we know testing for Boulder County is big. We know that our capacity really needs to be around 500 tests per day in order for us to go forward and feel comfortable that we have then the ability to find the cases that are in our community and then to control those cases. And I'm going to talk a little bit about that. We are roughly at around 100, maybe a little more than 100 tests per day at this point. That testing is improving. So we did find out this week from the State Health Department that we have the ability to expand some of those tests. We are going to expand those this week. And we do see that we'll be able to continue to expand slowly as we move into the weeks in front of us. We also need to make sure that we have containment. This is another component of the plans that we reviewed that was really important. And when I say containment, I mean that we have to have the number of people that once we identify positives with the expanded testing that we do, that we can go out and actually make sure that we're following up with those people, that we're isolating those positives and supporting them in their isolation, that we are following up with other people who are potential contacts. That's called contact tracing, to make sure that we have the ability to go out and talk to all the people that were in close proximity of that person who's positive, find out if they're potentially exposed, and then make sure that they're voluntarily quarantined until we can get them tested. That requires a lot of staffing, and it's far beyond the staffing that public health went into this disease spread with. In Boulder County, we are fortunate because we've been able to increase our staffing exposure, they can become positive. So there's a delay in the amount of time before somebody shows symptoms associated with the disease, if they show symptoms with the disease. And then after that, they still have to go to their doctor if they're showing symptoms. They have to make sure that they get an appointment. Their doctor then refers them for testing. That can take a couple more days. They get the test results back, which can take up to 5 to 7 days. I'm happy to report that the state lab is now returning positive tests within 24 hours. But some labs are taking up to 5 days, 5 to 7 days to return those tests. And then there's another period of time that's also another delay where somebody can show up in the hospital. So if we just looked for new positives and new cases as we went forward, it would take 3 to 4 weeks for us to see some of those cases showing up. And we obviously don't want to wait that long. So surveillance is important. The next criteria that was really important that we look closely at that I mentioned earlier was our hospital surge. And the way that this is looked at is that there's really no hospitals in the state that have to use crisis standards of care. And we don't have any hospitals in our state, as far as I'm aware of, that has had to use crisis standards of care. But we are closely monitoring the number of ICU beds that are in use, the number of ventilators that are in use, the number of capacity of additional ICU beds that are available, as well as medical or surge capacity beds that are available, because those are the things when we get into a surge that can make a difference on how we are able to deal with people who need not only support for COVID-19, but need support for other things in our community where they have to be at a hospital. And we have been monitoring that very closely. Our biggest concern right now in Boulder County, and another reason that we wanted to delay this order, is because we are seeing a significant surge in our long-term care facilities. We have expanding cases in our long-term care facilities. And what happens is, because those folks are in older age categories, they likely end up in the hospital and they're on ventilators and they're in ICU beds, and they're usually there for a longer period of time as well. So the length of stay can increase with our long-term care facility folks who are hospitalized, and that can create a surge on our hospitals and cause our hospitals to go into a place where they are running out of ICU beds or ventilators. And we're tracking that very closely. And again, luckily in Boulder County, what we're seeing is that we're not approaching those standards at this point. We do know that there's going to be a surge facility at St. Anthony's North that will be ready the second week of May. And we do not see that we will be in a surge place before that. And at least that's our hope at this point. We've done a lot of work with our long-term care facilities to assure that we're controlling the spread of the disease in those facilities as much as possible. And then the last thing that's really important is to have social guidelines in place. So social distancing guidelines are going to be important in every single scenario moving forward, because until we have a vaccine or we have a treatment in place, we know that this disease will continue to spread if we don't social distance. So social distancing guidelines are important. There's been a lot of focus on that over the last week. There will be a lot of focus on that going into this next week. And we want to assure that those are in place, that people are aware of those, and that they're able to follow those, especially as we move to the safer at home order, where we are opening things up more for people to be able to walk into businesses, as an example. So right now we only have curbside delivery and there's essential business services in place. But as soon as we open that up to more people walking into businesses or being able to gather in places, the more the risk of the spread of that disease. In any scenario moving forward, as I said, I think we will need to make sure we're following our social distancing guidelines and that we are looking at masking. And the last point before I show you what our case numbers look like here is that we, as you all know, if you were watching the governor's press conferences up to this point, we are moving from a place where, with the orders in place, we were about at 75% of social distancing. By lifting the portions of the order that go into place on May 1st and then on May 4th, we will be at 60 to 65% of social distancing, which means that we need to be able to effectively control the spread of the disease with that testing, expanded testing capability, the ability to contain people that are positive. So let me show you what our cases look like in Boulder County. If I can share this, I think I can do that successfully. So this is our website, and if you just search COVID-19 Boulder County Public Health, it'll bring you to this website. But I wanted to show you some of the case data that's on our that's on our website. And so this is our total number of cases. This is new cases by day. So you can see that our cases have gone up and down over time. This spike right here just has to do with delayed reporting from people that were entering data. So it is just delayed reporting that caught up with us on that one day. So that doesn't represent the actual number of new cases that occurred on that day. But you can see that we've gone up and down. Our 5-day average growth rate is still increasing in cases. Even though our case rates have stayed fairly low in Boulder County, we still have growing cases. So we need to keep a close eye on that as we move forward. And again, having that social distancing in place and really paying attention to making sure that we're thinking about where we can't social distance easily by keeping 6 feet apart, we need to be considering making sure that we have face coverings so that we're not spreading the disease. We know that face coverings can make a difference. And that's going to be important as we move forward into these next several weeks. This is up to every single one of us, whether we're successful in this stage or not. So the more that we pay attention to those social distancing requirements, the more that we mask if we are going to be close to people, the better off we're going to be in terms of how we move forward into the weeks and months ahead. Because we know, again, until we have a vaccine or a treatment, this is going to be part of our lives as we move forward. So I'm going to stop there, and I'm going to turn it over to Frank Alexander at this point, who's going to talk about some of the supports that we have in place here in Boulder County already. Frank?
Thanks, Jeff. Nice to see you, and thanks for having me on your presentation here. Really appreciate it. And I also just wanted to send my thoughts and heartfelt prayers to everybody out there who's been dealing with suffering in your family from a health perspective and also from an economic perspective. We know that the consequences of this disease have been profound, not just to the healthcare system and to people that have experienced the virus, but also the economic repercussions that are beginning to surface. And so Jeff wanted me to give a quick summary of how to get supports in our community. You'll see in the chat, and I'll ask Chana and Mike to share it via the Facebook Live if it's not possible that's automatically linked. You'll see some resource link pages that are really important for the community to know. And I'm going to share this PowerPoint with you. And so what I wanted to kind of highlight, I think the first thing that I think is most important for you to share with your family, your friends, your neighbors, your loved ones, your community, just generally, is the importance of reaching out for help and getting support now, early and often, and that we are here for the community to provide everything that we possibly can, and we've been geared up to do that. This is just a sample of the many programs and supports that are currently available and have been brought to scale within Boulder County across the 3 core departments here: this community services, public health, and housing and human services. So you'll see a whole series of resources that are accessible and available to families and individuals via the resource pages that I just linked to and that I will walk you through on. The one thing that I wanted to highlight the most, because it's been our #1 request thus far, has been for housing support and in particular eviction prevention. So from a flattening the economic curve issue, like Jeff's team is working to flatten the curve on COVID exposures, COVID cases, we are trying to flatten the curve on economic disruption. Here, the summary of mediation services available. The first thing we wanted to communicate was the landlord community throughout Boulder County has been very responsive and receptive to families who are at risk of being evicted from their housing. They have been working with residents in incredible ways. I really want to thank the landlord community for everything that you've been doing. Evictions are not being processed in the court system for non-payment of rent until the beginning of June. It doesn't absolve residents from their responsibility to pay rent, but landlords have been very accommodating about the fact that many families, individuals are having a tough time paying rent. So these resources are available. I wanted to just provide a quick go to the webpage very quickly to just show you what else is available. So what you'll see here on our page is a summary by subject area of all the resources that are available, including resources available for businesses, including resources available for folks experiencing unemployment, economic disruption in their household, the housing page that I mentioned, financial assistance, childcare, food, health coverage, etc. So these are really critical things to apply for and to access our support on. The easiest way to reach us has actually been texting. So our department just in the last 5 or 6 weeks has responded to requests from upwards of 15 to 20,000 individuals in the community that are needing additional support. Texting us is a fast way to do that. So you'll see on this slide the quick way to text us, 303-441-1069, and we'll get you connected to the support that you need. We are able to process applications for assistance, food assistance, cash assistance, medical support, medical insurance, via video conference and via phone. So all of that is happening remotely. And again, we want to encourage everybody. So many people, 20% of the population has now applied for unemployment. And we know that many more are experiencing drops in income. So we know that households are needing additional support. The ability to apply for health coverage has been extended for a few more days. But if there's been a drop in income in your household, you can apply for health coverage through the Connect for Health program. So please reach out about that. Please reach out about applying for Medicaid, for food assistance, and ask us about housing supports that you might need. So I'll leave this up for just a quick second so you can see these resources. The other thing I wanted to highlight was, in addition to the importance of us accessing resources, is to really continue to expand our social connectedness while we're doing our physical distancing and staying healthy. As part of that, as many of you know, we've had a regional affordable housing plan that has been focused on dramatically expanding access to safe and stable housing in our community. That has been a fantastic community partnership. We launched a Home Together campaign, which is people sharing their stories about what home means to them and the things that they are doing differently in the COVID crisis. So we encourage, there's some fantastic stories already. We encourage you to link to this and tell your story. So that's sort of the basic gist. But again, the main message to take away from tonight is that our community has scaled up. We are working in partnership with all of our community-based organizations, our family resource centers, our healthcare partners, all of whom are doing a fantastic job in the safety net. So please encourage anyone that you know to reach out for help, and we will ensure that we get you connected, we get your family connected as soon as possible. The sooner the better. Prevention is the best antidote to this economic situation that we're in. So the quicker the people get connected with resources and connected with one another, the better off we will be.
Thank you very much, Frank and Jeff.
In our new cases that would cause us to back up. We would not want to open things up if we saw that happening. That would obviously not be a good scenario because we would just facilitate the spread of the disease if we saw one of those two things happen. And if we push our hospitals beyond that surge capacity, then that's a significant issue for us locally here and for others across our region. So those would really be the two scenarios that we'd be looking for. We certainly are hoping that we don't see that. We don't anticipate seeing that. Our testing's increasing, our staffing's increasing, and we feel like we will be ready on May 8th. And then past May 8th is when it will be up to all of us to make sure that we are following that social distancing. That's what will tell the real story.
Thank you, Jeff. We have another question here for Dr. Urbina, our medical officer. Can you tell us a little bit about what antibody testing for COVID-19 does, how we will use that in the disease process for stopping spread, and exactly how do antibodies work?
Sure, great question. Frequently asked a lot on the national media. Just 30 seconds about testing in general. Currently, we're testing for the genetic material called RNA by using a nasal swab or an oral swab. That's the best currently we have to test for acute infection. The serologic testing is a very old test that we have used with other infections, and that's usually done from testing serum or blood, serologic testing. And it tests for antibodies, our body's ability to produce antibodies or infection cells to kind of fight off the infection. Because the novel coronavirus is so new, we actually don't know what that means yet. So we might detect antibodies maybe 1 to 3 weeks after the disease process ends, but we don't know how long that protection lasts. If we were to talk about measles or hepatitis A, I can draw you very clear a pathway of what antibodies produced, IgM, IgG, and how long they last, and how long the infection lasts. I can tell you that about a lot of viral infections, but I can't tell you that about the coronavirus because it's a novel coronavirus. Right now, we're using this antibody testing to see, to look for activity in our community. Again, not knowing exactly what that means, we're beginning to use a serologic or antibody test to say, could you have had the infection? And by testing a significant number of people, we'll be able to learn more about this disease process so that in the future, as we recover from this wave of infections, we'll be able to say, all right, now we know that the infection or the antibody test lasts for a certain period of time, and it may or may not produce lifelong immunity. So I think in the future, as we start to roll out these tests, and you see some states and some cities beginning to do that, but that's really to try to figure out what the life cycle of this disease is and how long our bodies can produce an infection to this, an antibody or protection against it. We don't know what it means yet, but I think you'll be seeing some of these testing probably in the next couple months here in Colorado and hopefully in Boulder so that we can figure out whether or not this antibody test is relevant to our control, containment, and spread that Jeff talked about a little bit earlier.
Thank you, Dr. Urbina. That was really helpful. Okay, another question. I think this might be for you, Kate. Kate is on our legal team at Boulder County. Is there any way to control the number of visitors to recreational areas during this time to decrease potential for resurgence of COVID-19?
Awesome. Thank you, Chana. Yes, as we know, individuals are allowed to engage in outdoor activity. Recently issued state law, which does apply within Boulder County, mandates that people should not travel further than 10 miles from their residences for recreational purposes. State law also requires playgrounds to be closed. We have partnered with local governments, local law enforcement, as well as park rangers to provide extra patrol at popular trailheads. If you decide to travel for recreation within 10 miles of your residence, please make sure that you are only parking in designated parking spots.
And should this be adopted by local municipalities or on a county-wide basis?
Thanks, Chana. That's a great question. And yes, I do support that. And we are thinking about that at the county level as well. We are going to be thinking more about that across our region. And the reason that's important is because we know that masks and specifically face coverings, and we want to differentiate between a surgical mask or an N95 mask and a cloth face covering for the general public, because we don't want to put more pressure on those medical masks and the N95s that are already in shortage at the state level. A cloth mask is effective at reducing the spread of the disease. There's been multiple research things that have been looking at that at this point. And we know that it can, even though there's differences in terms of what people think the effectiveness is, we know that it can be effective at reducing the spread of the droplets. And what's important about that, and the reason that we are so supportive of it, is that we know that 2 to 3 people, or anywhere between 2 to 2 and 5 people, all the way up to 4 and 5 people is what we've seen in the research over the last several weeks, can spread that disease asymptomatically. We know that people can be, now that we've seen this research, we also know that people are sometimes most, and I would ask Dr. Urbina to validate what I'm saying here, but that people can actually have the highest viral load in those early periods where they're asymptomatic before somebody does come symptomatic. So reducing the spread of the disease using a mask can be really helpful, along with social distancing, to control the spread of the disease, which is why we are so supportive of that. That does not replace, obviously, the need to do a lot of hand washing, make sure that when we're putting masks on or taking them off, that we're doing that carefully. There's lots of great online research and demonstrations of how to do that effectively, as well as appropriately laundering masks, because we do need to launder them. And there, again, there's really good research and some good videos and guidance online for that.
Thanks, Jeff. So it looks like we're right at 5:30, and we've made this short because these folks have to go to city council meetings and many other things that they have to do this evening. But we thank you very much for your time, and we will put a recording of this on our Facebook page for folks who missed it. So thank you very much.